You know that moment when you're staring at an anatomy textbook and all those structures start looking like an abstract painting? Well, today we're turning that confusion into clarity. We're breaking down the most effective ways to master anatomy for NEET PG, FMGE, and INICET exams with strategies that actually stick.
And trust me, it's not about memorizing every single detail. It's about understanding the patterns and relationships that make anatomy come alive.
I've heard you've got some game-changing approaches to this. What's the first thing students should focus on?
Well, according to recent exam patterns, there are clear, high-yield areas we should target. The neuroanatomy, embryology, and imaging sections consistently appear in these exams.
Oh, really? That's interesting. Can you break that down for us?
Sure. Let's start with neuroanatomy. It's not just about memorizing pathways. You need to understand the clinical correlations. For instance, knowing the cavernous sinus contents through the mnemonic "O Tomcat" can save you in exams.
Wait, oh, Tomcat? That sounds intriguing.
Yeah, it stands for oculomotor nerve, trochlear nerve, ophthalmic branch, maxillary branch, carotid artery, abducens nerve, and trochlear nerve again. It's a proven way to remember the arrangement.
That's brilliant. And I imagine these mnemonics are pretty crucial for quick recall during exams?
Absolutely. You know, there's actually a fascinating history behind medical mnemonics. They've been used for centuries, evolving from Latin verses to these modern memory hooks.
That's really interesting. But let's get practical. What about embryology? I hear that's a major challenge for many students.
Right. For embryology, focus on developmental milestones. The primary oocyte arrest in prophase of meiosis Y is a classic example. It's frequently tested.
And how does this connect to clinical scenarios?
Well, take the paraxial mesoderm development. Understanding this helps you diagnose conditions like scoliosis and muscle development issues in newborns.
That's a great way to make it relevant. What about imaging anatomy? That seems to be increasingly important.
Exactly. Modern anatomy learning has shifted dramatically with technology. Virtual anatomy platforms and 3D imaging have revolutionized how we understand structures.
Speaking of technology, I've heard there are some great apps for anatomy revision now.
Yes, but here's the key. Don't rely solely on apps. Combine them with traditional methods. The real power comes from integrating multiple learning approaches.
That makes sense. What about the practical aspects of revision? How should students structure their study time?
Based on the exam patterns, I'd recommend dedicating 30% of your time to neuroanatomy, 25% to gross anatomy, and 25% to embryology.
And the remaining 20%?
That should cover histology and genetics. You know, many students struggle with traditional anatomy learning because they try to memorize everything.
Right, instead of understanding the concepts?
Exactly. And here's something crucial: anatomical variations. Understanding these is vital for clinical practice.
Can you give us an example?
Take the brachial plexus. The mnemonic "Randy Travis drinks cold beers" helps remember roots, trunks, divisions, chords, and branches.
That's actually pretty catchy.
And it works. But remember, these mnemonics are just tools. The real understanding comes from clinical correlation.
Speaking of clinical correlation, what about surface anatomy?
Crucial topic. The scalp mnemonic for scalp layers is a perfect example. Skin, connective tissue, aponeurosis, loose connective tissue, periosteum.
These mnemonics are really helpful. Any others that are particularly high yield?
Yes, for the carpal bones, some lovers try positions that they can't handle. Scaphoid, lunate, triquetrum, pisiform, trapezium, trapezoid, capitate, hamate.
That's definitely memorable. How about revision strategies for the final weeks before exams?
Focus on high-yield topics. According to recent exam patterns, questions often come from upper limb nerve injuries, brachial plexus, and neuroanatomy.
And what about practice questions?
Essential. Previous year questions, especially from the last 3-4 years, show clear patterns. They're increasingly clinical and image-based.
That's really helpful. Any final tips for our listeners?
Yes, don't just memorize facts. Understand relationships between structures. It's like learning a language. Grammar is more important than vocabulary.
That's a great analogy.
And remember, anatomy isn't just about passing exams. These structures you're learning will be crucial in your clinical practice.
Speaking of practice, how important are dissection videos?
They're invaluable. They show you the real relationships between structures, which is something textbooks can't fully convey.
And I suppose that helps with understanding variations too?
Exactly. No two bodies are identical, and understanding these variations is crucial for future surgeons and clinicians.
What about time management during the exam itself?
Good question. For image-based questions, don't spend more than 45 seconds. If you're stuck, mark it for review and move on.
That's practical advice. Any thoughts on the order of revision?
Start with gross anatomy, then move to neuroanatomy, embryology, and finally histology. This builds a logical progression of understanding.
And how about study groups?
They can be effective, especially for testing each other on surface markings and discussing clinical scenarios.
That makes sense. It's like having a practice audience.
Exactly. And teaching others is one of the best ways to reinforce your own understanding.
What about visual learners? Any specific tips for them?
Drawing and sketching are powerful tools. Even simple diagrams can help understand complex relationships between structures.
And auditory learners?
Recording yourself explaining concepts and listening back while commuting can be really effective.
These are great strategies. What about revision schedules?
Aim for active recall every 3-4 days. Regular testing is more effective than passive reading.
And final revision just before the exam?
Focus on high-yield mnemonics and commonly tested clinical correlations. Don't try to learn new material.
That's really comprehensive. Any last words for our listeners?
Remember, anatomy isn't just about memorization, it's about understanding the beautiful architecture of the human body.
And that understanding will serve them throughout their medical career.
Absolutely. Master these concepts now, and they'll stay with you forever.
Well, that brings us to the end of today's episode. Thanks for these incredible insights into mastering anatomy.
It's been a pleasure. And remember, every great doctor started exactly where you are now.
Perfect way to end. And to our listeners, keep those mnemonics handy, and remember, O Tomcat might just save you in your next exam. Thanks for joining us on Copilot Podcasts.